We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Swords. Remember, you can text your questions. The number there at the bottom of the screen, 336-379-5775. So this person is asking, will masks cut down on flu transmission?
Short answer is yes. We know that wearing a mask cuts down on lots of different air droplet transmission, so flu, coronavirus. There's evidence even from other countries that have been in their flu season that their numbers of influenza have decreased dramatically because of the actions they took in relation to COVID-19.
All right, then the follow-up question is, will the flu shot help me against COVID-19?
Yeah, unfortunately not. There are two different viruses. The immunizations for influenza and the immunizations that are being studied for coronavirus are very different, and they're specific for the virus. Nonetheless, this is a great year to get the flu shot. It's safe, it's easy, it can't give you influenza. There's very few people who shouldn't be getting the influenza vaccine. This is a great year to get it because it will help prevent the flu, and you don't want to get flu and COVID at the same time.
Can you get the flu and coronavirus or COVID-19 at the same time?
Yeah, I'll summarize that. So the answer is yes. There are two different viruses. We know that people can get infected with more than one virus at the same time. That adds complications to any sort of co-infection. And so my plea is this is a great year to get the flu immunization. It does help protect you from the flu. The flu immunization cannot give you the flu. People might feel a little bit achy the day or two afterwards, but that's not the flu. This is a great year to get the flu shot.
This person said, I've had COVID and now tested negative. Can I get COVID again?
That's a great question. And we're learning a lot about COVID. So anything that I say today could change tomorrow. Generally speaking, we think the answer is no. And so if you had COVID-19 6 weeks ago, it's very unlikely that you're going to get it now. We really don't know how long folks are immune after they've recovered from COVID-19. So it is within the realm of possibility that folks could have had it 6 months ago. The immune response wears off and get it again. We really don't know that, and we don't have enough experience or patients who have come back with similar symptoms to really know what that likelihood is.
This person says, when the COVID vaccine becomes available, will masks be necessary?
It's another great question. This is something, my answer will just be predictive. We are hopeful that the COVID-19 vaccine will be effective, that it will produce a great immune response and make people less likely or unlikely to get coronavirus. If that's the case, masks will be less necessary, but it all depends on the effectiveness of the vaccine. If the vaccine is only 40 or 50% effective, it will still be absolutely the right thing to get it, but we will still be encouraging folks to wear a mask.
This person says, what good is wearing a mask while driving?
Yeah, it all depends on if you're alone or not, or if you're with family members that you live with or not. So if you are driving somewhere with coworkers, first of all, I'd encourage you to do as little of that as possible. If it's absolutely necessary, you should wear a mask. So people that you might be riding with, that you don't live with, you should wear a mask. If you're riding with your kids or your spouse or partner, it's unnecessary to wear a mask. If you're riding with someone else, wear a mask. And of course, if you're alone, there's really no need for a mask.
All right, this person says if you have been in close contact with someone in your workplace that tested positive for COVID, what should the employees who've been around this person do?
I think it all depends on the context, and most employers will have some sort of HR function that can help you walk through the particular. But in general, it depends on the degree with which you associated with your coworker. If you were in close contact with a mask, you have some certain risk of getting COVID. It's not 100%, but there's a higher risk. In that situation, your employer may want you to quarantine at home and work from home. If you were just in the same building and never got within 6 feet for any length of time, it's probably not necessary to do a self-quarantine.
So this person is asking, do you recommend HEPA filters for inside, such as workspaces, churches, daycares, restaurants, etc.? Are they effective in removing the COVID virus particles?
Yeah, another good question, and going to get out of my area of expertise pretty quickly. There certainly are some filters that are effective. We do know that air circulation is important, and when I say air circulation, it really means exhausting air out of a room and not recirculating it. But there will be a lot of experts who know about filtered air better than I do. The best thing is to filter air outside of the room and exhaust it outside of the room.
Again, knowing that it's airborne, knowing that it stays in one spot for quite some time, anything that moves the air is helpful. Okay, this person is texting, what is the risk when one person is correctly wearing a mask, the other person, though, is wearing the mask under their nose, and they are close proximity for 5 or 6 minutes?
Yeah, so first of all, the person who's wearing the mask should get a pat on the back and a thank you. So thanks for doing that. Wear the mask over your mouth and nose. And the person who isn't wearing the mask correctly should absolutely be encouraged to wear the mask correctly. What I really think should happen is if someone's not wearing the mask correctly, a gentle word, hey, your mask slipped off your nose. And I would encourage all of our community members, when they are reminded to wear a mask correctly, to just say thank you. No reason to pick an argument, no reason to defend anything, just wear the mask correctly.
And I suppose if you're feeling way uncomfortable and you don't want to say anything, you could possibly just take several steps back.
That's right. If you just are in a situation where you really can't control, leave the situation. Stay at least 6 feet away from somebody who really isn't committed to wearing the mask correctly.
So this person says, if we're walking on an outside walking track with others, should we be wearing a mask?
Again, I think the answer is it depends. If you're walking outside with a family member and there really isn't, and you live with that family member, there's really no reason to wear a mask outside. If you're walking with somebody and you're 6 feet away and there aren't very many people around you, again, it's probably not necessary to wear a mask. If you have conditions that put you at some risk for a bad outcome with coronavirus, I would tell you wear a mask all the time.
This text says, my son tested positive, but my daughter-in-law did not. What are the chances of her getting COVID, and what would they both need to do?
I think there's a high likelihood that people in the same house in close proximity will spread the infection to each other. There's a high likelihood of that. There certainly are some people who are immune and won't get it. But what they should do is self-quarantine. If your daughter has tested negative, it probably is in both of their interests to stay away from each other, separate bedrooms, and live that way for the next 14 days.
All right, so this person is asking, do you expect cases of COVID-19 to rise more during the winter months? I know there's a couple different thoughts with that, more people staying inside, but if more people are also wearing masks, does that help? And we've been washing our hands and we've gotten into that routine. So what are we expecting?
Yeah, I want to be optimistic here, but I'll speak to it both directions. Right now, with our transmission rate in our communities, we anticipate that the number of hospitalized patients will be at least as many as they are today. Um, and so the way that we can decrease hospitalizations and decrease the rate, the number of people who have that in our have COVID in our community is to decrease the transmission rate. And that means wear a mask, stay away from each other. I think we can still do that entering the winter months. We don't need to use an excuse that we're going to be close to each other in close proximity as an excuse not to wear a mask. We can stay away from each other even indoors, and we should wear a mask even if we're indoors with people with whom we don't normally associate.
Okay, gotcha. All right, so, and again, the numbers are on the rise, and so we need to be paying very close attention to that.
No question. Numbers are on the rise. We have record hospitalization numbers. Rate of transmission in our communities are increasing. Now's the time to wear a mask, stay away from each other, and this will go away. That's what we need to commit to each other, as we can make this go away together.
Yes, we all want it to go away. Thank you so much for answering our questions. We so appreciate it. And again, we know that things change as this goes on. And so the answers are good for today. And we'll see what happens even the next day or even the next week. So thank you, Dr. Swords.
Thank you.